Hi, everyone. Good afternoon, or good evening, or good morning, wherever you are in the world. I hope everyone can hear me clearly. It's almost 6 p.m. here. It's 5:59 on my clock. My name is Nadia. I'm from United Nations University International Institute for Global Health. And welcome to the PhD Fellowship Information Session. Just to wait for everyone to stream in, I'm just going to give 1 more minute or so before people can start coming in, and then we can start. Hello, hi everyone. Welcome to the United Nations University International Institute for Global Health PhD Fellowship Information Session. My name is Nadia Adnan. I am the program officer here at UNU-IIGH, and I'm also the PhD Fellowship Coordinator. I'd just like to welcome everyone to this information session. Thank you for joining us this evening. Just a few housekeeping, basically. Please, if you could have your videos on, make sure that you're on mute if you're not saying anything. Please raise your hand if you have a question, although we do strongly encourage you to also use the chat function for your questions. This information session should take approximately 45 minutes. There'll be an opportunity for you to ask questions at the end. Without any further delay, let's get right into it. Basically, this information session will be divided into two parts. I'll be talking about be giving you an introduction about the United Nations University, about the International Institute for Global Health, or IIGH, and then I will speak a bit about the Global Health PhD Fellowship specifically, including how to apply and the selection process. After which, I'll hand over to my PhD fellows, and they'll be able to explain to you the experience and how they got to where they are now. So basically, about the United Nations University. The United Nations University, or the UNU, is a global think tank, and it's also a postgraduate teaching organization headquartered in Japan. Its mission of the UN University is to contribute through collaborative research and education to efforts to resolve the pressing global problems of human survival, development, and welfare that concern the United Nations, its peoples, and member states. Not many people know about UNU, but UNU is a very solutions-focused, research-generating think tank to inform policymaking. And although headquartered in Japan, we have 13 institutes globally, each working in specific areas to advance the Sustainable Development Goals. The United Nations University International Institute for Global Health specifically. What are we? Who are we? Where are we located? Again, not many people know about UNU-IIGH, but UNU-IIGH is the designated UN think tank on global health. We are based here in Kuala Lumpur, Malaysia, where I'm actually sitting at right now. And although we are based here, we do have a global mandate. What does that mean? That means we work across issues on global health affecting the world over. We build global health knowledge and decision-making capacity and advance evidence-based policy on key health issues. The Institute's programming looks at the nexus of gender and global health, and particularly looking at global health in the Global South. We're divided into three areas or three pillars of work, basically. The first being translating evidence to policy. Here, we're translating health evidence for informed global policy. How do we do that? Basically, we're a neutral convener. We bring multiple voices to the table and to engage and inform effective policy making. Secondly, we generate policy relevant analyses. How do we do this? We apply a gender lens in health research. So this is the bulk of gender and health work. Our third pillar of work is looking at capacity building or strengthening skills for local decision making. Again, how do we achieve this? By having programs such as this, actually, the PhD fellowship program. But other than that, we also do training and conduct workshops on health systems and implementation research as well under this particular pillar of work. So now that I've given you a very brief overview of of UNU-IIGH, let me just go right into the PhD fellowship program itself. So what is the PhD fellowship program? So the Global Health PhD Fellowship provides PhD candidates with the opportunity to be part of the policy analysis and translation process of the UN. It's a unique opportunity for PhD candidates to be exposed to the UN system, as well as to be outside of the realm of academia. It is so the PhD fellowship program, the process itself, it's a competitive process. We have up to 2 to 3 placements a year. We call them cohorts. The fellowship will be based in Kuala Lumpur, Malaysia. This is, of course, subject to COVID travel restrictions. The fellowship lasts between 6 to 12 months, and a monthly subsistence allowance will also be made available. For the eligibility, again, here, just to mention that support towards travel may be granted on a case-by-case basis. By travel, I mean travel to Malaysia. But again, this is subject to COVID restrictions. So that's an overview of the program itself. The eligibility requirements, some may ask. The PhD fellowship program, as the name means, it's only open to candidates enrolled in a PhD program. So you must be currently enrolled in a PhD program in any recognized institution in the world. Your course that you've done for your PhD must be linked to one of the pillars of our work. We strongly encourage students from lower middle income countries to apply. Having said that, if you are attending or if you are doing your PhD in an institution based in the global north, but you are from the lower middle, you are from an LMIC or you're a national of an LMIC, you are eligible. You are strongly encouraged to apply. So we're not looking at your residency status per se or your institution status per se. We also encourage those who have already submitted their thesis and are waiting confirmation. Just to let you know the selection process and the application process. So the application is going to open on the 31st of January 2022. It will be an online application form. You will find this application form on our website under the fellowships section, and you will be asked to submit your application form along with your CV and a letter of recommendation from your primary PhD supervisor. The reason why we ask for a letter of recommendation or a letter of support is to ensure that your PhD supervisor is aware that you're applying for this fellowship program and that it aligns with the expectations that your mentor at IIGH will have and your PhD supervisor as well. Now, just to let you know the brief selection process after you've applied, what happens. Firstly, from application, then you go down to long list. We will long list you basically to see if you have met some of our minimum criteria, like the eligibility requirements I mentioned before. After this, you will be then shortlisted by any of our UNU-IIGH researchers, and then you'll be contacted for an interview. Sometimes some of your prospective UNU mentor would want to speak to your primary supervisor, and this is usually done at the initial stages before giving you an offer if you're selected, usually after the interview. Again, this is to basically to ensure that your PhD aligns with your expectations of being a fellow at UNU-IIGH. What can you expect? So that's the application process. What can you expect from your time here at UNU-IIGH? We will assign you a mentor. The mentor could be any of our research leads who are working in any of those three areas. And we will provide you with an orientation booklet. This orientation booklet will include all the information of the systems that we use, like we're talking about softwares and things like that, as well as information about living in Kuala Lumpur should the time permits. I mean, should the circumstance of COVID changes, then you're able to come here. Yeah, your UNU mentor will also design a work plan for yourself, and this is to basically for you to track your own progress throughout your time with us at UNU-IIGH. As a PhD fellow, we also do expect something from you. Just so that you know, the PhD fellowship program is actually a full-time, I wouldn't say job, but I would say you're expected to serve full-time. Flexibility around work arrangements is decided between yourself and your mentor, but we do expect you to be able to engage fully and attend a lot of our meetings, like our staff meetings or department meetings on a regular basis. And we really want you to be participatory in it. And just some of the other outputs other than that is that PhD fellows are expected to host a mandatory exit seminar. This seminar, the topic of the seminar could relate to your PhD as well as your time at UNU-IIGH, and also gives you an opportunity to talk about what you intend to do post IIGH, how you intend to use the knowledge that you've gained during your fellowship program. We also strongly encourage you to invite your supervisor or anyone from your parent institute to be part of this exit seminar. So although the exit seminar is for UNU-IIGH, we also do encourage you to invite lecturers and your supervisor from your parent institution. Another output that we expect from our PhD fellows is that they produce a written piece with their UNU-IIGH mentor. It can be a policy brief or a journal article. And if you haven't submitted your thesis yet, this could be appended as an annex to your thesis. And finally, we do expect you to do a bit of promotion for us. And this is in the form of a testimonial, either through a blog post or a video. And occasionally you'll be asked to join things such as this, where we do information sessions, and basically it's to help us promote the program to others. So before I hand over to the PhD fellows for them to explain a bit more about the work that they're doing, I just wanted to talk about some of the key dates for you to mark in your calendars. Applications, as I mentioned before, applications open on the 31st of January. Please bear in mind that if you check our website right now, there's no application form. That's because the application has not opened yet. The application period will last until the 21st of February, after which almost the entire month of March will be dedicated to the selection process. And there is an expectation for PhD fellows within this cohort to start on the 1st of April. Again, flexibility is, we do offer flexibility, but it depends entirely on your UNU-IIGH mentor. So one of the questions that would be asked usually during an interview is, when can you start? That should be, in a nutshell, everything about the PhD fellowship. I'm open to more questions at the end of the session. I'm sure there are some. So I'm going to pass the baton to the fellows first and let them just talk you through. I think the first fellow, there's three fellows currently with us. There's Aline, there's Zaida, and there's Rivka. These three lovely ladies have been with us since last year, and they're working in various sectors within our organization. So I'm just going to pass on to Aline first to talk a bit more about her work. Aline, take it away.
Thank you, Nadia. Hi, everyone. I'm Eileen. So if you are following UNU-IIGH social media accounts, especially on Instagram, you might have seen me last Friday during the Instagram takeover where I share a bit more about my day as a PhD fellow. So I'm currently a PhD candidate at Monash University, Malaysia. And at the same time, I'm a PhD fellow with Pillar 3, which focuses on capacity building. It has been the fifth month in UNU-IIGH, and I think it has been a very fruitful time throughout. So one of the projects that I've been working on is about looking at what are the barriers to optimum care among those hypertensive patients in Malaysia. So we are looking specifically at those from a lower income group. And so we've been conducting surveys, we've been conducting interviews with patients, the healthcare providers, and also the stakeholders. This project is in collaboration with the London School of Hygiene and Tropical Medicine, and the same project has been carried out in the Philippines, and now we are doing the part for Malaysia. So it's really interesting project to be in. And other than that, there are actually a lot of opportunities to work with different organizations while I'm in UNU-IIGH. And one of the other projects that I'm also helping out is with WHO Tropical Disease Research Organization, whereby we are helping to look at their one of the online learning course. So we are seeing how we are evaluating to see how we can further improve the learning experience and the learning outcomes of the participants. So if you look at the pictures on the right, on the top left, there's actually another picture taken together with Nadia and with my mentors and other colleagues. It was taken in an event with the Ministry of Health of Malaysia, the Institute of Health System Research. So it's one of the programs that we are collaborating with them, and that session is actually a workshop to disseminate the training programs that they have come up with. So I think for me, it's very interesting to be with UNU-IIGH because when I think back of my experiences, it really helps me widen my view and to really see the bigger picture of global health. For my personal project, is more focused on generating evidence, but the questions that follow really is after is really what's next? How do we translate the evidence into policy? And in UNU-IIGH, it really helps me to see that there are a lot of processes before and evidence can be used or can be practiced in normal lives, in daily lives, such as how do we engage with the right stakeholders, how do we convene, how do we train the people so that they know how to use the evidence. So it's all these parts that uh, makes the whole picture complete of putting the evidence into use. So I'm really glad to learn to think more about the impact of the research that I'm doing and all the work that I'm doing in IIGH. And if you see the picture on the top right, is a picture taken last year during our Christmas party. So you can see all the happy faces because I think this, I just want to use this photo to sum up what I want to say. To me, UNU-IIGH is really even though it's a small, but it's a very closely knitted family. And everyone there is very open and very willing to share their knowledge. So if you're thinking about this PhD fellowship program, I really encourage you to go for it. And if you need more information about it, do feel free to reach out to me. Thank you. And I'll just pass the time to Zaida, so she will share more about her experience. Thank
Thank you, Aileen, and hi, everybody. Welcome to the session. So as you can see, my name is Zada Orth. I am a research psychologist and a public health PhD student at the University of the Western Cape. And I have also joined the PhD fellow at UNU-IIGH under Pillar 2, which is focusing on gender and health, as Nadia mentioned earlier on. So just a bit more about this. I think it is such a also very diverse category as well, because we are looking at how do gender issues or what role does gender play in reaching all of these sustainable development goals. So yeah, just an overview of some of the projects that I've been working on. Like I said, it's very diverse. So there's people working on gender and digital health, universal health coverage, healthcare workers. But me specifically, I have been assigned 3 different projects, main projects this year. 2 of them I'm working closely with my supervisor as it was assigned to me. So the one currently is to try to generate evidence and to put a book chapter together on women leadership in health in Southeast Asia, which has been so interesting for me because, again, it's just being exposed to a different context and to different ways of working and generating this kind of evidence. So, for example, even though there are things that you might know about, or me personally know about gender, health, and women in leadership, that knowledge base is just grown with my engagement in this area. And with this, I'm also getting a lot of practical experience about looking for stakeholders, engaging with stakeholders, or even just identifying women leaders in this context that could be potentially useful to this book chapter, which was a lot harder than I initially expected. But like I said, it has just increased my learning on the topic so much. Another series that I'm working on is something that I got the opportunity to head myself. So I'm working a bit more independently on this, and it is to launch a I Wish I Knew series with some of the staff members at the UNU to serve as mentorship. So again, in that sense, they do give you a lot of opportunities to have support and engagement from your mentor, from your supervisor, and just everybody within the pillar as well. But again, you kind of get the opportunity to come up with your own ideas, to lead your own projects, which can be a little scary at first. But like I said, it's just such good practice and such good engagement. It's been a valuable experience in that sense. And then the final project that I'm working on now, which I can also encourage you to go take a look at, is a think piece and podcast series on the Gender Health Hub website. I don't know if we could share that. So basically, it's been a different series of think pieces and podcasts, and each one has a different theme, all relating to the power of. So, for example, the one is looking at the power of the collective, where we take a critical look at issues on how do civil society engage with leaders or people within health systems and health work to create these kind of partnerships so that we can further our goals in reaching health equality for all. So yeah, that's been a very interesting series. Like I said, you guys can go check it out, go give it a listen so that you can also get a feel for what are the kind of questions and what are the kind of issues that we are looking within this pillar. Yeah, so that was basically just an overview of some of the projects I've been working on. But I want to say that if you are thinking about doing this, it is an amazing opportunity. I think Rivka and I both shared a picture of a laptop, if you guys can see in that corner over there. And the reason why we did this is because, unfortunately, due to COVID, we are working remotely. So we are based in South Africa. And again, it's been a very interesting experience looking at the different times. How do you manage that? But I can honestly say that it is what you make of it. So the effort that you're going to put in and the work you're going to put in will return to you doubly if you do it. So I don't think working remotely has taken anything away from the experience at all, just because everyone within the system has been so amazing. They have reached out, they offer advice, they're always available for communication. I think we are also very fortunate enough to have this type of communication platforms where, you know, you can have Teams or Zoom. Even though we are in different countries and different time zones, I can pop a quick message to my supervisor if I need her, and we can keep the communication flowing in that way so that, you know, the work doesn't come to a standstill, but we all get to reach our targets at the end of the day. So yeah, just in terms of the work culture, I think this is amazing. And again, because COVID has kind of halted a lot of opportunities for us, I think, and I think PhD can be a bit of a lonely journey for some people, depending on the context you're working in. There's not always a lot of opportunity for engagement with outside of your little field. So again, this opportunity, you get to meet people from diverse settings, from diverse academic backgrounds, all in different areas as well. So that is a good interdisciplinary experience as well, if that is something that you are looking for. And yeah, I think Eileen also said it so well when she said, looking at how the bigger picture is coming together with the work that you're doing. So for me specifically, I would always have questions on, there's so much research on a specific topic or a specific problem, and how is it that we get that to work in real life? So I've personally been working in academia exclusively for the past couple of years. So this opportunity was really great, like Eileen said, to get me to see what are the working parts, how does it all come together, what is being put in to generate this evidence, and then taking this evidence and actually making it work in real life context and making those policies and translating that into interventions and evidence that can be used. So yeah, this has been an invaluable experience just in order to get that practical side of what does public health look like outside of an academia realm, specifically for me. And yeah, so like I said, you guys can go check out that Think Piece series. And also, like Elaine said, I'm available if you guys have any questions, if you wanted to ask anything more. Yeah, so I think with that, I will hand off to Rivka. Thank you.
Thanks, Ida. Hello, everyone. I'm sure my colleagues have already sold you on doing this, applying for the fellowship. Hopefully, I can still add my 2 cents in. So my name is Rivka. I'm also registered at the University of the Western Cape in South Africa. I started my PhD in 2020, so right bam in the middle of the pandemic. I was very happy when I had the opportunity to start the fellowship at UNU. I was assigned to Pillar 1, which, as Nadia mentioned, is about translating evidence to policy. I was ecstatic when I was assigned to the Lancet Commission on Gender and Health, and that's what I've been working on mainly since I've been here. So the Lancet Commission brings together global and diverse stakeholders to respond to urgent health issues. And in this case, it's gender and health. So I've been working with really prominent experts in the field to write a chapter on responding to the pandemic and why and how gender matters. So as part of this, I've been involved in several literature reviews related to COVID-19. Among those were gender-based violence, reproductive and maternal health care, and leadership. So these were all subject areas I didn't know that much about, and it was really interesting to actually read about this and learn about something other than my PhD topic, or a little bit, like Zaida said, a little bit outside of my PhD topic. So it was good to get some fresh information. And also to learn from actual leaders in the field, So we are currently synthesizing the results of the literature review and writing it up. And then just in general, this fellowship has been an amazing opportunity to meet, network, and collaborate with international experts in the field. It's been great to learn directly from these experts that I probably would never have had access to otherwise, and also learn different styles of working. Maybe there's a certain way that we work in South Africa, and now I've seen what people might work like in Malaysia and India and Australia. And I had to be flexible in time, such as with meeting times and having meetings across different time zones, since I'm based remotely in Cape Town. It also gave me an awareness of the importance of gender mainstreaming, and actually helped me to generate ideas for my thesis that wasn't maybe specifically maybe going to take gender into account, but I'm thinking of a chapter, so I'm very excited to start with that. And also, it's just been inspiring to be part of the UN global system. We've got to attend seminars held by world leaders. So it's so wonderful just seeing, leaders and women leaders as well. And then something that Zaida touched on, which was that PhDs can be very lonely. And starting my PhD in 2020, that is what I found. You socially isolated, you have to do the distance rules and all of that. So this fellowship was a challenge to get out there, virtually meet people. And I feel like I didn't think it was possible, but I feel like I've made friends in this time. And I feel like I've made like lifelong connections with people. I'm extremely thankful to the UNU for the opportunity that I've had, and I would encourage any PhD students to apply. And as my colleague said, you are welcome to reach out to me if you have any questions. Thank you.
Thank you so much, Rifka, Zaida, and Aline, for your sharing. And I feel like you've sold it to me as well, even though I'm the PhD fellowship coordinator. But I'm very happy and pleased to know that you're having a fruitful and enjoyable experience here with us. So, in the interest of time, let's get the questions rolling. So if you do have any questions, please do write them down in the chat box and let us know. Okay, I see there is one current question, which is basically, are there only 3 pillars of work? To answer your question, yes, we do have these 3 focus areas at UNU-IIGH. However, underneath each of these focus areas, there's a bunch of other things that we do. So, for example, I think, like Aline has mentioned, in the capacity building, there's work with NCDs, and then under the Lancet, there's multiple work as well. And then with the gender and health, there's a book chapter. There's also expert meetings. So there's various things within each pillar of work. So I do strongly encourage you to visit our website to read a bit more in depth about the work that each pillar does. I think the other question that we have is, how flexible is the start date? So ideally, we would want to start 1st of April because unfortunately, we're saying goodbye to our current cohort of PhD fellows in March, which I'm very sad about. But to give some opportunities for other people, we're opening the cohort again. So we don't want a big gap, which is why 1st of April. But we do understand that some people need some flexibility around it based on academic calendars and so on and so forth. So this is subject to, I think, negotiation. So we are flexible, yes, to answer in a nutshell. The next question is, can I still apply if I'm not able to start in August? Is that August, or I'm assuming that means April? We do encourage you to let us know in the application form when you're actually able to start. So I'm not going to let this I will not let this discourage you from applying. But just do indicate, there is a section within the application form where you can indicate when you're available to start. I think another question is, should the PhD be perfectly aligned to the pillar? I feel like I can pass this on to one of our PhD fellows because some of them, it's not necessarily perfectly aligned. It is connected somehow, but I think, either one of the PhD fellows, any of you would like to answer that question?
Maybe I can just start because so my PhD currently is on conceptualizing and making an instrument to measure mental health with adolescents living with HIV, which basically, as it sounds, doesn't really have a lot to align with the Gender and Health Hub on the surface level. But I think also just having a very strong interest for me, like I said, I was very interested in gender, and that's something I brought through very strongly in my application, and also the previous work that I've been involved in that also had to do with gender in health. So if you do have some relation to the topic or some interest in the topic that you want to explore further or highlight, or if it's something that you're very passionate about and have previously worked in, you could do that, or even try to align your PhD with it, even if it is not the main focus. So, for example, with adolescents living with HIV, adolescent girls are a key population within that context. And so you can also think about how does those gender issues align with other health-related issues as well. So it's basically all about how you align your application as well and what you want to highlight as a focus, if that makes sense.
Thanks, Zaida. Rifka, Haleen, any of you want to just add on?
Okay, I can go. So my thesis isn't that much aligned, but I've got a policy component of my thesis. So when I was doing the interviews, I focused on this, that, I want to learn how to do policy analysis. So that's where they thought that it was a good link. So it wasn't 100% aligned, but a little bit of something there. Thank you.
Yeah, I just want to add that my PhD project is actually on health economics, and which is linked to palliative care and some quality of life in advanced cancer patients. So it really has nothing much to do with the scope of work that I'm doing now, but what does matter is really some of the skills are actually transferable, like the skills that I've learned throughout my PhD, where I did qualitative analysis and interview. Those skills are actually transferable and valuable while we are doing your fellowship in UNU-IIGH. So I don't think it's too much of a worry, but really what is your, like what Jaida said, what is your focus, or what is your interest, and how do you align that with the different pillars? Thank you.
Great, thank you. So the next question that we have here is, have there been instances when universities denied PhD students to attend the fellowship? While I've been managing this program, there hasn't been any instances, But that is why actually we ask for a letter of support or letter of recommendation from your PhD supervisor. It's basically to mitigate this risk. And we want them to also be involved to know that you're working with us. So that's why. The next question is there a preference to those who have submitted their thesis? Um, there is a preference to a certain extent because we understand how um, laborious a PhD is, and especially if you're at the stage of data gathering. So I think there is that preference because, like I said, it's a full time commitment, the PhD fellowship program. But at the same time, again, you should not let that discourage you. It is a preference, but it's not necessarily set in stone that we will reject applicants who have not yet submitted their thesis. The next question is, are you all based in Malaysia or working remotely? I think Rivka and Zaida made comment to this. Zaida and Rivka are both actually working in South Africa, so they're working remotely. Aline is based here in Malaysia. But yeah, so UNU-IIGH also practices flexible working arrangements, so we do work either remotely or in person in the office. The next question I see here is, I'm a PhD student in environmental health with research focus on malaria. Do I stand a chance to be selected based on the pillars? Again, I wouldn't let this discourage you from applying. It depends on how you actually write your application and your letter of motivation. Like what Aline said and what Rivka also mentioned, how you're able to sell yourself even during the interviews. So yeah, I think you shouldn't let that be a deterrent because your focus is still health, so it's not completely unrelated. So you should consider applying. What is the maximum number of PhD placements available? As I mentioned, for this, it's a competitive process. For this particular cohort, we're looking at 3 to replace our current 3. So yeah, we're looking at 3. There's another question here. If we want to conduct a quantitative study, does IIGH have any data or access that can be shared with us? I'm slightly unsure what that question means. Like, do you want to access IIGH data or while you are doing your PhD or when you're doing a PhD fellowship? So if the person who asked that question could just elaborate a bit. There's another question here from Lucas, and I was selected for the final interview but was told I was overqualified. May I reapply? Yes, you can reapply. There shouldn't be any problems. But again, like I mentioned, it is a competitive process. So yeah, there'll be a lot of other applications, but you're definitely encouraged to apply again. But yeah, so I think if you do have any other comments, again, please do write it in the chat box. And please do just keep them coming. If you're joining us from Facebook or YouTube, just write in the comments as well any questions that you may have for us. The next question we have here is, how relevant is health data analytics to this program? I have to admit, I'm not a researcher, so I can't answer that question per se. I don't know if any of the PhD fellows want to take a jab at this. Any takers? Rivka?
Okay, maybe I can have a go. I suppose it's, how do you translate whatever your analysis shows? How do you translate that into policy? So once once you have your data and analysis, what is your recommendations, or you need to be able to solve? How does it matter? And that's where UNU can help in teaching you how to to craft your argument of why your data matters.
Okay, great. Yeah, so If there aren't any other further questions, in the interest of time as well, I just wanted to thank everyone, thank my colleagues as well for being part of this information session. Just to reiterate again, these are some of the key dates for you to know or note. The 31st of January is when applications open. So that's next week, Monday, 31st of January. Applications will go live on our website. And if you do have any questions in the meantime, please do write to us at phdfellowships@unu.edu. Again, the information is available on our website. You would also know when applications open because it will be promoted on our social media, so do follow us. And if you have found this information session fruitful and informative, please do share your feedback with us. There's a QR code now on screen. Please do scan the QR code to answer some of the questions. It shouldn't take any more than 5 minutes. Again, thank you so much for joining us, and we appreciate your feedback to improve the sessions or just to let us know any other feedback that you have for us. And yes, we're happy. Thank you very much.